Alright, so I am in the med room and I noticed my patient has an order for 40 milligrams of furosemide given IV. We have a bottle that is 10 milligrams per milliliter, so I'm going to need to draw up 4 milliliters for them. So to get started, I'm going to take my syringe and open up a needle, attach it to there. Okay, so I'm going to draw up some air. I'm going to draw it up to 4 and inject that into my vial that hasn't been used before, or else I would wipe it off with an alcohol swab. So right there we have 4 milliliters. So that is 40 milligrams. Okay, so now I'm going to take this needle and I've got a new syringe. I'm just going to squirt out some of that into this garbage can so that I have room to put my furosemide in it. I'm just going to stick that in there. Now I would block my needle, take it off, and dispose of it in the sharps container. No? So it's in the sharps container. Now we're going to label so we know what this med is when we go to give it to the patient. So I'm going to write the medication and dosage, and then I'm going to put it on here. We're not going to put any identifying patient information because in case we get distracted, we don't want that on our patient. Okay, that's labeled. All right. Hi, my name is Stephanie. I'm going to be your nurse today. Before we get started, can I get your name and date of birth?
My name is Susan White, January 10th, 1989.
All right, so I've washed my hands. I have an order. I checked your wristband. I can see that you are who you say you are. I have an order for your furosemide today. Do you know what that is?
I don't.
Okay, so it is a medication that's used to get the excess fluid off of you. So in your case, I see you have heart failure, so you're building up a lot of fluid that makes it difficult for you to breathe sometimes. Maybe you have some edema, so this is going to help with that. Some side effects are going to be that you are going to have to use the bathroom a lot. You're going to feel the urge to urinate, and you also could get hypotensive, which means your blood pressure is low. You might get dizzy standing up, so I want you to use this call light and call someone whenever you're getting up to go to the bathroom. We'll just be here just to make sure you're safe, okay?
Okay.
All right. Before we put this medication in, I gotta verify, do you have any allergies that you're aware of?
No.
All right, so that is good. We can continue as planned. Right. So I've washed my hands. I have all my supplies here. You get those set down. I'm gonna stop your pump that's running right now. You get that stopped and clamped off. All right. So that's shut right now. We're gonna open this. I've got an alcohol swab to clean it off. I'm gonna scrub for 30 seconds, make sure we get that good and clean, and then let it dry because we don't want any stinging when that happens. So first, before we put the medication in, I've got a flush. I'm just gonna hook that up. Flush that in, make sure there's no infiltration, it's going where it's supposed to go. Alright, we're good. Now that we've got that, we've got your medication here. Again, this is your furosemide. 40 milligrams is what we have ordered for you. So we're going to hook that up. And we're going to put this in over 2 minutes, so it's going to feel like a long time. I know that I'm just standing here talking to you. But we want to go in slowly to make sure we don't have any rapid side effects. Just want to assess how the medication is affecting you as we put it in. So So 2 minutes have passed, the medication is in. I'm gonna take that off and we're gonna do one more flush before we get you hooked back up to your maintenance fluids. So that flush. All right. And then I'm gonna wipe off this also before we get you attached because I just had that laying down. And make sure we get that good and clean. Okay. And hook it back up. All right, how are you feeling right now?
I'm feeling okay.
All right, so I'm gonna unclamp this tube and start your fluids again. All right, so again, you have your call light within reach. I want you to call me when you feel like you need to go to the bathroom. We just want to be here to make sure you're not getting too dizzy when you stand up. Okay?
Okay.
All right. So I would document that that was given, all the fluids given with it, because we want to keep strict eye and nose with heart failure patients. And then I would come back and reassess.
Wash hands.
And wash my hands on my way out after I discard all this garbage.